Australia nears an end to HIV after 40 years of testing. 40 years after HIV screening first became available in Australia, the nation is closer than ever to eliminating transmission of the virus, a milestone unimaginable in the dark early years of the epidemic. New data from the Kirby Institute at the University of NSW shows diagnoses have plummeted 53% among those born in Australia in the past decade, with 757 cases reported nationwide in 2024. There was no reduction for people born overseas, so the drop among the whole cohort was brought down to 27% once those figures were taken into account. The long-term trend is downward, even though numbers have risen slightly in the past 2 years. Experts say the recent uptick reflects a rebound in testing and behavior after the COVID-19 pandemic rather than a reversal of the overall decline. Heath Painter, CEO of Health Equity Matters, the National Federation for Australia's leading HIV and LGBTQ+ organisations, believes Australia's HIV response is a result of strong community leadership and consistent political support. "We've had great success in reducing HIV in Australia over the past decade, driven by strong community leadership and rock-solid political leadership," he says. The long-term trend is clear. Australia is closer than ever to achieving the virtual elimination of HIV transmission. The trajectory contrasts sharply with the early years of the epidemic. The first AIDS case was recorded in 1982, screening was introduced in 1985, and new diagnoses peaked in 1987 before a rapid decline driven by condom campaigns and needle and syringe programs. But not everyone has shared equally in the progress. Mr. Heath Painter says on top of no reduction in diagnoses being observed among people born overseas, nearly 1 in 3 new cases in 2024 were considered late diagnoses, meaning people had been living with HIV for years before detection. Late diagnosis is a major concern. It delays treatment, increases the risk of serious illness, and allows ongoing transmission, he adds. Making HIV testing easier and more accessible, including self-testing, is essential so people can know their status and connect with care. It will take Australia one step closer to eliminating the virus altogether. "We are closer than ever to achieving this goal. Renewed effort and focus will allow us to make further progress," Mr. Heath Painter says. To close those gaps and accelerate towards elimination, the federal government last year announced it had committed almost $44 million, some $26 million of it to subsidize pre-exposure prophylaxis for people not eligible for Medicare. New awareness and prevention campaigns have also been funded, along with vending machines for HIV tests, expanded mail-outs of self-testing kits, and workforce training for health professionals. Australia has also formally endorsed the U=U principle, or undetectable equals untransmissible, which states that people with HIV who maintain an undetectable viral load on treatment cannot pass on the virus sexually. While HIV is trending down, other sexually transmissible infections are moving in the opposite direction. Syphilis and gonorrhea diagnoses have more than doubled over the past decade, and chlamydia remains the nation's most common STI, with more than 100,000 cases in 2024, or an increase of nearly 18% in a decade, according to the Kirby Institute's latest data. These data, on a backdrop of rising STIs, are concerning, according to epidemiologist and lead researcher, Dr. Skye McGregor. Chlamydia, gonorrhea, and syphilis are easily treated and cured with antibiotics, she says. Early testing, diagnosis, and treatment prevents serious outcomes. HIV, while not curable, is highly treatable, and diagnosis and starting effective treatment early prevents poor health outcomes and interrupts onward transmission. Aboriginal and Torres Strait Islander peoples continue to be disproportionately affected, with rates of syphilis more than 5 times higher than among non-Indigenous Australians. HIV notification rates for First Nations people almost halved over the decade to 2021, according to Australian Institute of Health and Welfare data. Changes in notification rates have been influenced by access to care, improved screening and accuracy of tests, experts say, with the percentage that were late or advanced diagnoses decreasing from 46% to 29%. Despite signs the elimination of HIV is possible, For National Association of People with HIV Australia President Scott Harlem, much more needs to be done if it's to happen before the end of the decade. It's important to remember that each of last year's 757 diagnoses are individuals, he says. There is a face and a name behind every one of those data, each with lived experience of the reasons why health systems have failed to prevent HIV transmission. This reinforces the critical importance of people with HIV sharing our lived experience so we can build a better understanding of HIV and effectively plan a response which enables year-on-year declines in new cases until we reach the virtual elimination goal.